Good afternoon, everyone. Thank you for being here. I've told my colleagues behind me this is already the best press conference I've been to. It's great to be joined by so many of you today to deal with such an important issue. At November's organization session, I talked about many issues that I wanted the House to address over this year in this session. While not all of those issues were popular among every single member, but the one we're here to talk about today is one that we all agree on. Every baby should have the opportunity to be born healthy. And every mother should get the maternal health care she needs to set up herself, her family, and her child to thrive. In our Health and Human Services Committee, chaired by Representative Colleen Burton, who's here with us today, our members have been digging into the research since organizational session on the outcomes for mothers and their children. And that research shows that vulnerable, low-income populations have higher risks of maternal mortality by 3 to 4 times. That research also shows that 1/3 to 1/2 of maternal deaths occur in the postpartum period. But for mothers, most likely to fall into the most vulnerable category are mothers who are covered by Medicaid. Their period of coverage is currently only good for 2 months after their child is born. Today, the Florida House is making a meaningful commitment to address the disparities in health outcomes for our children and for their moms. We believe that providing access to postnatal coverage for up to 1 year after the birth can significantly boost health outcomes for moms and their babies. And we know that healthy moms are better positioned to raise healthy and thriving children. We also know that this pandemic has affected nearly every aspect of our life over this past year, including maternal health care. And the new moms may be facing even tougher challenges than they've ever faced before during these isolating times. So today, as part of our Medicaid conforming bill that will be noticed later on today, we are proposing a simple extension for the covered timeline for pregnant women already covered by Medicaid from 2 months to a full year after delivery. To accomplish this endeavor, my House colleagues and I are committing $200 million into that Medicaid conforming bill to make this a reality. This extension will do a lot of good for those moms and for their babies, but we acknowledge that it won't solve every problem. We need physicians and medical experts to play their part in educating patients, and we need better career and education programs to drive Floridians to in-demand jobs where there's healthcare coverage. We're working on those things too in this House. But this is a step that we must take to help support an important and vulnerable population, our pregnant moms and their babies, during and after their pregnancy. You will see that we have a significant buy-in from our colleagues, both from the Republican side and the Democratic caucus, to ensure that our state is very best when it comes to maternal health care. I'm proud to stand alongside the members of the Republican and Democratic caucus, particularly those members of the Health and Human Services Committee, chaired by Chair Colleen Burton, who has led them over the last several months to look into this issue, Representative Camilla Brown, who has spent much of her time in the legislature working on this issue and giving research and engaging her committee members on the topic, as well as the ranking member in healthcare, Representative Nick Duran, Dr. Andrea Fryel, who is with us today from Tallahassee Memorial Hospital, will be speaking with us as well about the role that this will play in helping moms and their health outcomes. With that, I'd like to introduce the chair of the Health and Human Services Committee, Chair Colleen Burton.
Hello, everybody. I am smiling just so broadly. I know we all are, but I'm Colleen Burton, and I am glad to stand here today among friends and colleagues to celebrate life and to support mothers. The Health and Human Services Committee has heard from many experts who gave compelling testimony about social disparities and determinants of health and maternal mortality. While we learned that Florida is a leader in many areas when it comes to maternal care in the prenatal period, the post-delivery period is a particularly vulnerable time, and ongoing health care is essential to a new mother and baby's well-being. New mothers may be dealing with a host of medical issues such as complications from childbirth, pain, depression, or anxiety, and they are bearing this while caring for an infant. The postpartum period is also when many cases of maternal mortality take place. We believe that in 2021, maternal mortality should be a never event. Inadequate care can result in poor health outcomes for infants, which can in turn impact their development. And because about half of all births in Florida are already covered by Medicaid, extending their period of insurance coverage will help significantly improve health outcomes statewide. In these additional 10 months of coverage, we can provide moms with the ongoing care they need, things like regular checkups with the OBGYN, mental health service, or even dental care. As you can see today, and the speaker referenced, members from all sides and all backgrounds in the Florida House are committed to the well-being of Florida's babies and mothers, and we want to see them thrive. Thank you, Mr. Speaker, for your leadership, and to our members from Health and Human Services and more for your support today and always. Thank you.
Thank you, Chair Burton, and thank you for the testimony and the research that was conducted in your committee in the Florida House. We try to do our homework when best we can, and this was a topic that the HHS members did a fantastic job of digging into, to bringing in experts to get to the facts. We know that great ideas come from both sides of the political spectrum. And on that note, I'm happy to bring up our next guest, but before I do, I want to acknowledge that Representative Camilla Brown has been working on this issue for a long time, and has been talking to her colleagues in both the Republican and Democratic caucuses for a long time about this issue. And if it wasn't for the hard work that she has done to pave the path for this, the work that we have been able to do here today and we are going to announce later on today would not be possible. We're grateful for her work and her willingness to work with us. And with that, I'll bring up Representative Camilla Brown.
I am certainly excited today. Hello, everyone, and thank you, Speaker Sprouse, for bringing us here together today for this very, very good news. And thank you for allowing me to stand here alongside you, Chair Burton, to just give a few words. For decades, new mothers have only received 60 days of the postpartum Medicaid coverage. But the reality is that more than half of the maternal deaths occur after that time. Currently, Medicaid is the health insurer for 45% of the births here in the U.S., and with 66% of those births are births to Black mothers. By investing greater resources in the budget for this program, we are really providing life-saving support for new mothers in need. The Center for Disease Control and Prevention estimate that 60% of maternal deaths here in the U.S. are actually preventable. And to be perfectly clear, extending this coverage will save lives. As we previously heard, this problem impacts minority communities disproportionately. Disparities in maternal health equality results of mothers of color in Florida being 3 to 4 times more likely to die from pregnancy-related causes than white mothers. And that is why this year I sponsored House Bill 645 to do exactly what we are talking about today. And that is extending coverage from 60 days to 1 full year. Mr. Speaker, I thank you for this very productive partnership. Although the final product, it won't have my bill number on it, I definitely can smile, and we all can be proud, because today, the problem that we continue to talk about will be addressed. This 12-month postpartum Medicaid coverage really this extension is critical for mothers going leaps and bounds beyond what is offered in the past. And we're talking about 60 days that was put in place from 1976. This will help make certain that we are ensuring protecting mothers and babies when they need it most. So again, thank you for your support on this issue, Mr. Speaker, but more importantly, thank you for your leadership and your commitment. It is my hope that today's strong step forward from the House is one of many steps to the opportunity for all mamas to live and be mamas. Thank you.
Thank you, Representative Brown, and thank you again for everything that you've done on this issue and for bringing us all along with you in that education process to helping us get here today. I want to acknowledge Leader DuBose, who's here with us as well. Thank you for being here and for your leadership on this issue as well. And you know, the leadership in the Healthcare Committee who've done the work on this, the ranking member, Representative Nick Duran, who's here with us today. I hope he won't mind me sharing this with you all, but Representative Duran came to see me before session and talk about his legislative goals and priorities like many of the members have here today. And he could say, look, these are the things I'm interested in, but more than anything else, all I really care about is what Representative Brown has been working on for so many years, and that is the disparities in maternal health care, and anything we can do to make that happen and make that a reality would be my #1 goal for this session. So I'm proud to welcome the ranking member in health care, Representative Nick Duran.
Thank you, Mr. Speaker, and I guess who let the dogs out? They're here to celebrate with us as well. Thank you, Speaker Sprouls, for your leadership in making today possible. Last fall, I remember leaving the organizational session hopeful that we may be able to take on emerging gap and access to health care issues for some of Florida's most vulnerable populations. Rep. Brown and I were both seated next to each other in the chamber during the Speaker's organizational address last fall, and I remember us both commenting to each other how we enjoyed the Speaker's interest in working to improve infant and maternal health outcomes. And in January, Chair Burton led what I think was a monumental workshop in our Health and Human Services Committee on maternal morbidities. We spent the entire committee meeting exploring issues that impact racial and ethnic disparities in maternal health care. A monumental committee that I think it was just something to see. The Florida House movement toward extending postpartum Medicaid coverage is an important down payment to support maternal and infant health. Continuity of care is the key to maternal health. An extension of postpartum coverage would be a meaningful step to improve outcomes by helping ensure that individuals receiving ongoing medical care receive it. I am thankful for both Speaker Sprouls and Chairwoman Burton for their leadership and willingness to work with Rep. Brown and her leadership and her pioneering on our end for the caucus these important issues. This is certainly going to improve our Medicaid program, but more importantly and undoubtedly it will help and improve the lives of many infants and mamas. Thank you very much.
Thank you, Representative Duran. Now it is my pleasure to introduce Dr. Andrea Fryel, who's the Chief Medical Officer at Tallahassee Memorial Hospital and formerly an obstetrician. Dr. Fryel recently served as our Doctor of the Day during the first week of the legislative session, and she's here today on her birthday. Yeah. Dr. Fryel, I hope we could offer you no greater birthday present than the present of helping moms and their newborn babies. So thank you, welcome.
Thank you, and actually, this is the most amazing birthday present. It certainly is a milestone birthday for me, but look at I'm so excited to be here to celebrate this tremendous work that this legislators have done. Our nation's rate of maternal morbidity and mortality is rising, and a growing body of evidence shows that many of these deaths, particularly from preventable or treatable causes such as overdose, suicide, hypertension, diabetes, occur after pregnancy, related to when Medicaid coverage ends. In the state of Florida in 2018, for example, 50% of all pregnancy-related deaths occurred after being discharged from giving birth. Extending Medicaid coverage will help eradicate preventable maternal deaths and allow for continued management of hypertensive disorders, cardiovascular disease, diabetes, and other medical conditions that require management well past 60 days postpartum. The United States is experiencing a maternal mortality crisis. As the largest single payer of maternity care in the U.S., covering over 42% of births, Medicaid has a critical role to play ensuring healthy moms and babies. 1 in 3 women experience a disruption in insurance coverage before, during, and after pregnancy, and nearly 60% of these perinatal insurance disruptions occur in a period of uninsurance. We have been advocating in Florida and our legislators are not only listening, but also taking action. ACOG is taking action at the state and federal levels to ensure all women whose pregnancies are covered by Medicaid can keep their Medicaid coverage for at least 1 year postpartum, including coverage for such services as case management, outreach, substance use disorder treatment, and mental health screening and treatment. Maternal health experts, they all agree. In addition to being endorsed by over 275 national and state-based organizations, extending Medicaid coverage beyond 60 days postpartum is a leading recommendation of state maternal morbidity and mortality review committees and state departments of health throughout the nation. Maternal health experts in Arizona, Georgia, Illinois, Iowa, Louisiana, Maryland, Texas, Utah, and Washington have each highlighted this policy already as one solution among many to ending preventable maternal deaths. Florida will now be part of this important step, leading the way to support efforts to reduce maternal morbidity and mortality. Thank you, Speaker Sprouse, for your strong leadership in preventing maternal deaths in Florida, and thank you, Chair Burton and Representative Brown, for bringing attention to this problem and working to solve it. This will certainly make a difference. I'm proud to be in Florida today.
Thank you, Dr. Fryel, for being here, for your work for moms and their babies, and for helping us not just educate our committee members, but to educate Floridians about this. Folks, look behind you. This is what working together looks like. This is what working together looks like on an issue that is important to so many thousands of mothers and their newborn babies across the street. I couldn't be more proud to be with all of you today. Thank you for that. Thank you for your hard work in making this a reality. We're all looking forward to rolling out our Medicaid conforming bill today to help mom and their newborn babies. So thank you all. With that, I'll take a couple questions on this topic. Yes, sir. Well, I think they probably just heard about it. So, we're excited to work with them on this issue. We've had great partners in the Senate, great, partners with the Executive Office of the Governor. So we look forward to engaging with them on this.
A conforming bill makes it sound like it's not a one-year thing, that would actually outlive your budget. So is this something that you're funding with recurring dollars? Is this something you think transcends your speakership?
Absolutely. This is not a one-time, one-year commitment. If we're going to be truly committed to mothers and the health of their children in the long term, it needs to be signaled in both word and deed that this is a long-term commitment, and that's what we're going to do in the Medicaid conforming bill.
Well, this bill would extend Medicaid eligibility. The House and Senate have said Medicaid expansion is a non-starter. Why does Medicaid work here but not in a broader sense?
Yeah. Look, we've had this conversation about Medicaid expansion, and reasonable people can disagree. What this is about today is what we agree on. And no matter where you go in this state, no matter what organization you are, what school or what community center, when you ask people, who is our most vulnerable population, one of the common themes that everybody, without exception, will mention are moms, new moms, and their babies. We always can't agree, Leader DuBose, on every single issue in the legislature, but this is one we all do agree on. And that's why we have been so committed unabashedly to tackling this issue this session, and that's what we intend to do.
So even though everyone's using extension, there is a certain acknowledgement that this is an expansion then?
No, it's not an expansion, right? So it's an existing population of people who are already covered. As you know, Christine, covering healthcare, expansions have to do with new populations who currently aren't in the Medicaid coverage. Pregnant women, I think it was Representative Brown said 1976? 1976, 2 months. This is an existing population that is covered by Medicaid. What we have learned through Representative Brown's hard work and the hard work of the HHS committee is that it's just not enough. It's not enough time to get people connected and engaged in their health care, to make sure that the mom is healthy, to make sure that baby is healthy. We are all committed, all of us, members of both parties, to mothers' health care and the health care of their children, and that's what we're doing in this extension from 2 months, adding the additional 10 months to make sure they're covered for a year.
A lot of the new moms that are covered under this have had a tough year. This has been a really hard pandemic for a lot of people. Mental health is on the front of mind of a lot of people, both in the space and in lawmaking. And although there are a few marginal improvements in the works making their way through the legislature, there hasn't been any broad overhaul of the state system. Do you think the legislation proposals are adequate to meet the challenges of mental health this session?
That's a big question, right? Mental health is a huge topic that goes across, silos of government, from your healthcare to your K-12 education. I don't think that there's going to be any dispute that the mental health challenges are going to be have been exacerbated by the pandemic and the social isolation, whether you're a child who may have not been interacting with kids or you're an elderly population who's been disconnected to your family. So that continues to be a problem. Today we're focusing on maternal health care, but no question for young moms who maybe don't have the kind of support system that they typically have. I think that there's no doubt that it's been a more significant challenge for young mothers this year during the pandemic than in years past.
So do they get placed in Medicaid managed care plans, or they fee-for-service? How is this logistically going to work?
So the same way it works now, except the extension of time. So nothing changed from that perspective. We are working through the Medicaid plan to extend it for the 12-month period of time, but the healthcare delivery system doesn't change. So with that, as well as the many organizations, Representative Brown and I have talked about the great work that Healthy Start has done to help deal with some of the disparities in maternal health care. So this is everybody needs to be in the game on this, whether it's folks like Dr. Fryel, who's educating patients on a basis, whether it's Medicaid and making sure that there's coverage, or our community groups. We're all in this together to get to the same goal.
Last question.
Anybody else? All right. Thank you all very much. Appreciate it.